How can you tell the difference between bipolar disorder, which has depressive episodes in it, and unipolar depression, or just pure depressive illness? Well, it's pretty tricky, and that's what this video is all about. But before we get started, I just wanted to introduce myself. My name is Dr. Sil. I'm a junior doctor working in Sydney, Australia, with a special interest in mental health medicine, mental wellness, and mental illness. So if that's something you're interested in, you can consider subscribing, or no, you can just consider subscribing. All right. All right, let's get into it. So, bipolar disorder is essentially a depressive illness with episodes of mania peppered throughout, okay? And it's really important to know whether you have a depressive illness or a bipolar illness because the treatment is very different. Now, if all you've had in your bipolar illness is the depressive episodes, then how would you know that it's a bipolar illness, right? It would just look like a depression. And in fact, many people who have a depressive illness label or diagnosis will end up having a manic episode, and actually in reality they had a bipolar illness. So what are some signs that can make you think twice about whether it's depression or bipolar? So here are 5 signs that your depressive illness could be bipolar that hasn't fully presented itself yet. And I'm using these 5 signs based on the DSM-5, which is the diagnostic manual that many mental health professionals use to diagnose mental illness, and also the Bipolarity Index, which I'll link to the paper in the description of this video. So number 1, the age of your first depressive episode. Now with bipolar, it generally tends to have its first depressive episode between the ages of 15 and 20, whereas with depression, it usually has an average age of onset around 30. Now this isn't an absolute indication that it's one or the other, but it's suggestive. The second sign is that antidepressants aren't helping. Now, you can't make this judgment, after a week of trialing antidepressants, because you need to give them a really good go, usually around 6 weeks of an antidepressant. But if you find that it's not helping or even making things worse, then that could be that this depressive illness isn't a pure serotonergic issue, that it's actually not a depression, it's a bipolar illness. And if it's making things worse, like you're feeling more anxious, more unwell, then you need to talk to your healthcare provider sooner rather than later, because it could be triggering a manic episode. You can imagine that if you're depressed and you have low serotonin levels, that having the SSRI medication, which increases serotonin in your brain, that actually improves your mood. But if you have bipolar and you increase the serotonin, then that can actually elevate you into a manic episode. So if you feel unwell on SSRIs, talk to your GP. So the third point that could suggest that you have bipolar instead of depression is, do you have a first-degree family member who has the diagnosis of bipolar disorder? Now, whether it's type 1 or type 2, it's very genetic. So if your mum or your dad or your brother or your sister has a diagnosis of bipolar affective disorder, then that really increases your risk of having this illness. If it's a cousin or someone else in the family tree that's a bit beyond first degree, then the risk is significantly less. So don't worry if it's a cousin of yours that has bipolar disease. That doesn't increase your risk that dramatically. Okay, the fourth factor that could suggest bipolar versus depression is that it has a cyclical nature to it. When your depressive illness, I should say, has a cyclical nature. Specifically, if you have more than 3 episodes of depression within 5 years, that increases the risk that it's a bipolar illness rather than a depressive illness. With bipolar, it's usually a cycle and it follows a kind of pattern, whereas with depression, you can have a depressive episode and then have nothing for years, and then it can come back. But it doesn't follow a pattern, unless it's seasonal affective disorder, which is like kind of yearly depressant. Anyway, that's a different entity in itself and beyond the scope of this video. Now, the fifth and final factor is that mood stabilizers, which are the treatment for bipolar illness and not generally used first line with depression, if they give you a full recovery and resolve your depressive episode, then that's pretty suggestive that it's a bipolar illness. Again, it's not a perfectly indicative thing. Nothing in mental health is that clear cut. But if you use a mood stabilizer like valproate or quetiapine or lithium, and you have a really positive response to it, then that's very suggestive that it could be a bipolar illness. Now with depression that's quite severe, sometimes psychiatrists will prescribe a mood stabilizer as an adjunct with an SSRI, and that could still be a depressive illness. So as I said, nothing is that clear cut in mental health, but those are the 5 key differences. So that's it for this video. Again, none of these 5 things are absolutes. Nothing in mental health is that clear cut, but they could suggest that if you've been given the diagnosis of a depressive illness, and you have these 5 things, maybe it should be reconsidered and you should consider bipolar illness. Maybe. Worth thinking about because the treatments are different. Now, I wish you all an absolutely wonderful day. If you have any questions, leave them in the comments below. If you want to support the channel, the best thing you could do is just leave the video a like, and I wish you all a wonderful day, as I said. Okay, I'll see you all in the next video. Bye for now.